Hello there. Today I'm going to talk on the cerebellum. Cerebellum is a part of the hindbrain, and this topic today which I'm going to take is the first part of cerebellum. So here what we'll do, students, is that we will describe the anatomy of the cerebellum and see how it's made up of different components, and the functionalities we'll deal with in part 2 of cerebellum. So cerebellum or little brain, why it is called the little brain? Because like the brain, it has got two hemispheres united by a portion in the midline, that is the vermis. So cerebellum is a part of the hindbrain. You can make out the cerebellum. It's located here. Hindbrain consists of pons, medulla and cerebellum. So cerebellum is located posteriorly and is our little brain, because just like the brain, it has got two hemispheres united together by a central part, median part called the vermis. So our brain has got two hemispheres and the corpus callosum is lying in between the two cerebral hemispheres. Similarly, the vermis is here. So that is why we refer to the cerebellum as the little brain. Its shape is like that of the brain only. So why is cerebellum important? Well, with the internal ear, the cerebellum is responsible for maintenance of our equilibrium. So balance, indeed, maintenance of balance is a big issue, and cerebellum and internal ear are responsible for maintenance of balance. Then maintenance of muscle tone. Now what is the muscle tone? Muscle tone is the normal tension of our muscles. So it is the resistance we feel when we compress the muscles. So the cerebellum is responsible for maintenance of our muscle tone. And then this is very important, coordination of voluntary motor activity. So whenever we perform an action, the different body parts, they act as a cohesive unit so that functionality is attained. So each part has got a role and the parts then work in a coordinated manner, or they work in tandem with each other so that that activity is accomplished. So cerebellum has got a role in maintenance of equilibrium, our posture, and cerebellum is important for our coordination. This sense of coordination is the latest, is the most developed um, action of cerebellum. So we will do that in detail. So now I told you the functions of cerebellum. Now when these functions are compromised, it leads to the manifestations of cerebellar disease. So we have given medical terminologies have been assigned to each of the loss of functionalities. So loss of balance is referred to as disequilibrium. Loss of tone is referred to as hypotonia, while loss of coordinated muscular activity is referred to as dyssynergia. So the two hemispheres are united together by a median worm-like vermis. So vermis is the portion which is joining the two cerebral hemispheres, and it is like the corpus callosum. So if you look at the surfaces of the cerebellum, the two surfaces of the cerebellar hemispheres from above, then we make out that the two hemispheres are continuous with each other. So there is no gap between the two hemispheres when the cerebellum is viewed from above. So the two superior surfaces, they are in continuity with each other. Okay, if you look at the cerebellum from above, we do not see a gap here. So the two cerebral hemispheres are in continuity with each other. While if we see the cerebellum from the inferior surface, there we can make out that there is a notch, there is a gap there on the inferior aspect where my thumbs are. So there is a gap there on the inferior aspect, and that gap is referred to as the vallecula. So cerebellum, when viewed from the inferior aspect, it depicts a gap. So if I hold my two fists like this, and the thumbs are representing the vermis. So when we look at the cerebellum from the inferior aspect, you see my thumbs there, there's a gap here. So in this area, so this gap is referred to as the vallecula. While when we look at the cerebellum from the superior aspect, then there in that case, there is no gap. So in that case, there is no gap. So the surfaces are in continuity with each other. There is no gap in between. So I hope you get the point. So cerebellum has got anterior and posterior notches. So that I think will be appreciated more here. These are the two cerebellar lobes and this is the vermis. So this here is the anterior notch of the cerebellum and it is lodging the medulla and pons. Well, this here is the posterior cerebellar notch and this is lodging the falx cerebelli. Just like the falx cerebri, fold of dura mater separates the two cerebral hemispheres. The falx cerebelli, the fold of dura mater which separates the two cerebellar hemispheres. So, then cerebellum has got fissures. So fissures you can make out here. One is this primary fissure which is on the superior surface, and this primary fissure is the one which is separating the anterior lobe of cerebellum from the middle lobe of cerebellum. Then there is this horizontal fissure here which is separating the superior and inferior surfaces of the cerebellum. We will subsequently do that. There is another fissure of the cerebellum known as the posterolateral fissure that we will come to later on. So when we look at the cerebellum from the superior aspect, we find, this is a diagrammatic representation, we find that there are two cerebellar hemispheres and there is a central vermis. So this central vermis, you know, it has got parts, and we on the superior surface, when we look at the cerebellum from the superior aspect, we can make out the following parts: LCCDF. So LCCDF means lingula, culmen, lingula, central lobule, culmen, declive, folium. So central lobule, you remember, it comes before culmen. So LCCDF, these are the different parts of the vermis when we see the cerebellum from the superior aspect. Now corresponding to these parts, we have the parts of the lobes of the cerebellum. So for lingula, there is no part of the cerebellar lobe. For central lobule, we have the ala. For corresponding to culmen, we have the quadrangular lobule. Corresponding to declive, we have lobulus simplex. Corresponding to folium, we have superior semilunar lobule here and here on this side, on the other side. So these are the two cerebellar hemispheres. This is the vermis. LCL, C, DF, they represent the different parts of the vermis. These are the different parts of the cerebellar lobes on each side. And of course, since we are seeing the cerebellum from the superior aspect here, there is continuity between the cerebellar hemispheres and the vermis, and there is no vallecula here. So when we look at the cerebellum from the inferior aspect, what do we see? So we had LCCDF there. Then in the vermis, we have TPUN. Okay, so T stands for tonsil, P stands for pyramid, U stands for uvula, L stands for, N stands for nodule. And for the cerebellar lobes, we have the corresponding parts. Corresponding to tonsil, we have the inferior semilunar lobule on each side. Corresponding to the pyramid, we have the biventral lobule on each side. Corresponding to the uvula, we have the tonsil on each side. So this tonsil we have in the cerebellum also. One tonsil we have in the neck and one tonsil in the cerebellum. And then we have the nodule, and corresponding to the nodule, the part of the cerebellum is the brush bottle shaped part, which is referred to as the flocculus. So here, students, you must appreciate this posterolateral fissure. Posterolateral fissure is the one which is separating the middle lobe of cerebellum from the posterior lobe of cerebellum. And so here you see the nodule and the flocculus, they together make up the flocculonodular lobe. So that is separated from the rest of the cerebellum by this posterolateral fissure. So this diagram shows the subdivisions of the cerebellum as seen on the inferior aspect. This is just a diagrammatic representation. I told you earlier also, when we look at the cerebellum from the inferior aspect, there is a depression between the two cerebellar hemispheres referred to as the vallecula. So this is showing you the different parts of the cerebellar hemispheres and the vermis in a tabulated manner. So this table I need you to draw for your assignment if you are watching this class as a part of your regular curriculum. Otherwise, you just keep on following me here. So you see in this table, we have the anterior lobe, posterior lobe and the flocculonodular lobe. So these are the subdivisions of the vermis and these are the subdivisions of the cerebellar hemispheres. I'll not go into the detail by naming each part again because I've already shown you in the diagram initially. So this is the median section of the cerebellum. So here again we can appreciate the vermis that has been split like L, C, C, D, F, T, P, U, N. This is the horizontal fissure. So above this is are the parts of the vermis in relation to the superior surface of cerebellum, and below this are the parts of the vermis in relation to the inferior surface of the cerebellum. Anteriorly lies the pons, below which lies the medulla, and this is the cavity of the fourth ventricle. So since this is a median section, we are seeing the different parts of the vermis here. Now, anatomical subdivisions of the cerebellum are different from morphological subdivisions of the cerebellum. The morphological are more functional in nature. We will see subsequently. Now here I want you to concentrate on the anterior lobe, which I have already mentioned lies anterior to the fissura prima. The posterior lobe lies between fissura prima and the posterolateral fissure on the inferior surface, while the flocculonodular node is the smallest one. So here again in the median section we can appreciate fissura prima on the superior surface. So this yellow portion is the anterior lobe, this green portion is the middle lobe, while this blue portion is the flocculonodular lobe, which is separated from the posterior lobe by the posterolateral fissure. So the lobes of cerebellum, remember, anatomically are anterior, middle and posterior, with the fissura prima separating the anterior and middle lobes and the posterolateral fissure separating the middle and flocculonodular lobe. This is the pons and this here is the medulla. So this is the cavity of the fourth ventricle. So if we look at the internal structure of the cerebellum, just like the cerebellar hemispheres, it is made up of an outer layer of gray matter, inside is white matter. And just like the cerebral surface, inner part of cerebral surface, the white matter, it has got masses of gray matter referred to as the basal ganglia. Similarly, the white matter of the cerebellum has got masses of gray matter referred to as the nuclei. So cerebellum has a structure somewhat similar to cerebrum in the sense that outer layer is the gray matter, inner is the medulla, white matter. Outer layer is the gray matter, inner layer is the white matter, and that white matter has got masses of gray matter which we refer to as the nuclei of cerebellum. So the distinctive thing here is that the white matter gives appearance of branching pattern of tree called arbor vitae. This has been referred to as the tree of life. So you see here in this section, this is the gray matter, this is the white matter. This white matter has got nuclei which are masses of gray matter in the cerebellum, and you can make out this tree-like branching pattern which is referred to as the arbor vitae or the tree of life. This is the pons, this is the medulla, cavity of the fourth ventricle. So we can make out the vermis and we can also make out part of the posterior lobe here of cerebellum. This is the anterior lobe, this is the posterior lobe, and this is the flocculonodular lobe. So this is showing you the cerebellar nuclei. So as I told you, outer part of the cerebellum is made up of gray matter, inner part is made up of white matter, and that white matter has got nuclei. Now what are the nuclei? D, E and F, dentate, emboliform and fastigial nucleus. So they are lying inside the gray matter. So you must remember the names of these nuclei: dentate, emboliform and fastigial nuclei of cerebellum. Now, what are cerebral peduncles? Cerebral peduncles, they are the connections of cerebellum. So it's a part of hindbrain. So cerebellum has got connections with medulla, and that connection is referred to as the inferior cerebellar peduncle. It has got connection with pons, and that is referred to as the middle cerebral peduncle. And what is lying superiorly? The midbrain. So the cerebellum communicates with the midbrain through a bundle of nerve fibers referred to as the superior cerebellar peduncle. Now the inferior cerebellar peduncle contains afferent fibers, middle cerebellar peduncle afferent fibers, and remember, superior is the one which is consisting of mainly efferent fibers. So what are peduncles? They are communications from the cerebellum to the midbrain, pons and medulla, that is the brainstem, and they are named according to their position. The superior one connecting with the midbrain is called superior cerebellar peduncle. The middle one connecting with the pons is called middle cerebellar peduncle, while the inferior one connecting with the medulla is called the inferior cerebellar peduncle. So here in the diagram we can make out the location of these peduncles. So this is the location of superior cerebellar peduncle connecting the cerebellum with the midbrain. Middle cerebellar peduncle connects it with the pons. Inferior cerebellar peduncle connects it with the medulla. And here you can make out the arbor vitae and this white matter of the cerebellum showing you the dentate nucleus. Now this is a schematic representation of fibers in the cerebellar peduncles. So here we can make out the different cerebellar peduncles. So this one is the superior cerebellar peduncle, this one is the middle cerebellar peduncle, and this one is the inferior cerebellar peduncle. So you can make out here that the inferior cerebellar peduncle is consisting mainly of afferent fibers, and the main afferent fibers are vestibulocerebellar tract and dorsal spinocerebellar tract. So the fibers are coming into the cerebellum, so that is why this being the cerebellum, this is referred to as an afferent tract, the inferior cerebellar peduncle. Middle cerebellar peduncle mainly consists of fibers coming from pontine nuclei coming to the cerebellum. Again, it is mainly an afferent tract. While the superior cerebellar peduncle has got afferent fibers from the ventral spinocerebellar tract. Dorsal spinocerebellar tract is going into the inferior peduncle, while the ventral spinocerebellar tract is passing to the cerebellum through the superior peduncle. But superior peduncle has got mainly efferent fibers, as we mentioned earlier on also, and those efferent fibers are passing from dentate nucleus, emboliform nucleus, globose nucleus. They are passing through the superior cerebellar peduncle and going on to the red nucleus. So this is a very important diagram, a very significant diagram which I want you to practice, so that if you get a short note on cerebellar peduncles, you are able to answer the same. Now components of inferior cerebellar peduncle. So mainly afferent fibers, and I've already mentioned in the diagram dorsal spinocerebellar tract and the vestibulocerebellar tract. So other than that, you remember it by the words ORPC. Okay, ORPC. O stands for olivocerebellar tract, R stands for reticulocerebellar tract, P stands for parolivocerebellar tract, and C stands for cuneocerebellar tract. So you remember that dorsal spinocerebellar tract and vestibulocerebellar tract, they were shown in the diagram. So they are the afferent components. Other than that, if you remember the word ORPC, O stands for olivo, R stands for reticulo, P stands for parolivo, and C stands for cuneo. So these are the other four components, afferent components of the inferior cerebellar peduncle. And the efferent components, again, if from ORPC you take O and R, so cerebello-olivary tract and cerebello-reticular tract. So O and R. So these two are the efferent components of the inferior cerebellar peduncle. So students, you have to memorize this because this comes in the examination. Enumerate the components of the inferior cerebellar peduncles. So you remember that in the diagram you had the vestibulocerebellar tract and the dorsal spinocerebellar tract. Other than that, you have ORPC, and if you use the O and R, cerebello-olivary tract and cerebello-reticular tract, they are the efferent fibers of the inferior cerebellar peduncle. So this is the inferior cerebellar peduncle. So middle cerebellar peduncle, the fibers are coming from the pontine nuclei to the cerebellum. Okay, so mainly the fibers are afferent. There are no efferent fibers in the middle cerebellar peduncle. Then we concentrate now on the superior cerebellar peduncle. So the main afferent component is the ventral spinocerebellar tract. The dorsal spinocerebellar tract was passing through inferior cerebellar peduncle. So this is the afferent component, while the efferent component is from dentate, emboliform and globose nucleus. The fibers are passing to the red nucleus. Other than that, some fibers from the fastigial nucleus pass to the reticular nuclei. So you should know what are the fibers which constitute the different cerebellar peduncles. So this ends the class today. And what did we concentrate on? We concentrated on the different parts of the vermis, the different parts of the cerebellar hemispheres. We realized that the cerebellum has got anterior, middle and posterior lobes, and three fissures are there. So fissura prima is there, horizontal fissure and posterolateral fissure. And then we did the cerebellar peduncles and its constituent fibers. So students, here if you see this diagram, this is an eye catcher. So the girl here is saying balancing is a fine art. Isn't it a fine art, balancing? It is not that we are trapeze artists, but in normal day-to-day activities, what happens if we lose balance? So this balance, we should be thankful for this balance to our inner ear, the vestibule of the inner ear, and the cerebellum. So this girl here is trying to maintain her balance, and she's saying the balancing is a fine art. And this person here, who I have named as Innovatio, he says big thanks to the inner ear and cerebellum. So this diagram is just to reinforce the concept in your minds that cerebellum, we should be thankful to cerebellum for maintenance of our balance and equilibrium. The other important functions of cerebellum are maintenance of tone and maintenance of coordination. So this is part 1 of my class on cerebellum. I shall be uploading part 2 soon, and there we will show how to test the different functional aspects of the cerebellum and how evolutionarily the cerebellum is divided into archicerebellum, paleocerebellum and neocerebellum. It's all very interesting. So see you soon listening to part 2 of cerebellar anatomy. Thank you always for being with me. Bye bye.